Good evening, Rabab. Can you hear me?
Hi, good evening. How are you doing?
I'm very well, thank you. I'm excited for our talk today, and
Yes.
thank you everybody who's joining us live. It's very much appreciated. We will be recording this talk for anybody who couldn't join live. Myself and Rabab are really excited to share some ideas with you today. Although this is a talk, we have prepared just a few pictures to support our discussion. That's mainly for me because I am a visual learner, you see, and also very forgetful. So there were some points that I wanted to ensure we included today. So Rabab, I believe you're going to share your screen, is that
Yes,
correct?
I will share the screen for our help. So basically, let us start with our talk today evening. Just give me 1 second. I will share my screen. Uh, okay, is the screen visible to everyone?
It is, yes. Thank you so much, Rabab. I can see that. So shall we just start off by introducing ourselves to our audience so they know exactly who we are. So my name's Teju Shonaga. I've worked in education and special education for probably about 12 years now. And that has been divided with the UK and here in Dubai. Across that time, I've done various roles within education, teaching, special education coordinator, director of inclusion, assistant principal, and now I am the head of the Bridge Learning Centre. The Bridge Learning Centre is a centre for students of determination who have individualised needs but would like to be in the mainstream environment. So we provide specialised education settings with the help of our own therapists and also some of the Hope therapists like Rabab, which is going really wonderfully, I think, thus far. Rabab?
Thank you. So, hi, this is Rabab. I'm an occupational therapist and I'm working at Hope AMC. So basically, we at Hope see a lot of children with determination who have neurological disorders, be it physical or all the children on spectrum, handling difficulties, learning difficulties. And we are giving school-based OT as well. And this is basically a talk just to understand what self-regulation strategies that can be used in a classroom setting for children who have difficulties in attention, concentration, sitting tolerance, etc. So let us go ahead with this. Ms. Teju, ready?
Yes, please do go ahead.
Yeah. So yeah, what is basically self-regulation? It basically is a analysis of a task and like regulating yourself in a given situation or a given environment when you have to sit and attend to any activity that gives a functional outcome, like could be learning, could be reading, writing, just playing with other children. You need to be into that zone to be there and just attend to the activity. Oh, sorry.
Exactly. And just as you said, it covers a range of different activities. And that's not just academic, it also involves our sensory, our thinking skills, our emotions. And it really does have an impact on almost everything that we do in our lives. And we maybe as adults don't recognize all of the self-regulation strategies we have developed. But when we're working with younger children or students of determination or those that are typically developing, we can see how much just having healthy self-regulation can help us with school success.
Yes. So basically, self-regulation has these three categories in which more is more sensory based, emotional based, or thinking based. Emotional based can also be behavioral based, like how to like the behaviors that the children depict. The children who have autism or on spectrum or who have ADHD, they show a particular behavior, so they are their emotional regulation is kind of affected. So this is basically to understand the behavior and how do you regulate yourself in a given environment. So why sensory like self-regulation important for school success is basically when you have to like just copy things from the board, for example, and you cannot look onto the board and look back to your book when you have to write. It's basically if you are not emotionally regulated, or if you have a lot of sensory if you are sensory overly stimulated and you cannot sit at one place to just look at the board and look down again to write, it will is going to affect overall in your academics as well. So yeah.
Exactly, Rabab. And, like you say, it can come down to just those simple things of being able to copy off of the board. And here are just some illustrations of things that children might find tricky if they're not regulated. And it's being patient when they want a toy, and that's obviously impacting their friendships and their social relationships. Just planning what to do next in activities, even if that's playing with blocks or cooperating with other children, just being able to plan what would be the appropriate action next. And Rabab mentioned regulating of emotions. So when children have those strong feelings, it's them being able to choose the appropriate action and outcome and response in return, and also how they monitor and adapt what they're doing throughout their day.
Yes, definitely. So going ahead, so is like self-regulation, like what are the good self-regulation activities, and which are you have to choose like what exactly helps or benefit your child in a classroom setting to be self-regulated. So you want to just add upon this, Ms. Teju?
Yes, and this is just some examples of something that I myself have actually done with students, where we help them to understand what's a good choice and what's not so much of a good choice. And without those processing skills, that we find that children will make the wrong decisions. They might find themselves having arguments with others, not sharing, crossing personal space barriers or bubbles. And these are the things we see when children need further support within self-regulation in school on a daily basis. And like I mentioned, this isn't just for those children who have additional needs. Typically developing children will also need reminders and support when it comes to self-regulation across these different terms.
Yes. So yes.
So something that I just wanted to draw attention to as well, Rabat, is that there's a relationship between what we call metacognition and self-regulation. And this is where it really interacts with school success. So metacognition is children knowing how they learn. It's the ability to know how you think and how you learn and apply that to your academic tasks. And then self-regulation, of course, is monitoring and controlling your feelings and your behaviors and your sensory needs. And then when we couple that together, we have this self-regulated learning. And what I've illustrated to you here is the learning pit, which is a self-regulation and metacognition tool that we use for our primary children so that they can understand when they're facing a challenge in the classroom. For example, if they've been given a task that's very hard, they need to know that they have to have a go, and they go down into the pit and it doesn't feel great. And when they're problem solving, maybe they feel a little bit nervous, a little bit anxious. And this is where those behaviors will occur if we don't have those healthy self-regulation strategies. So we actually need to, as teachers and parents and practitioners, teach the children the skills to climb their way out of that pit, and then get to the other side where we have that successful learning. So it really does, there are many, many different components, and we're going to talk further about how we can actually do this in our discussion as we go along.
Yes, definitely. A lot to add on to this. So yeah, in simpler terms, it's basically we act as a thread, a bridge, like you talk about, between the like from how to self-regulate a child to have their optimal them to be optimal functioning. That is what it is. I mean, they need to come out with the flying colors. That is the better cognition, the behavioral, the sensory, everything goes hand in hand, and we just act for them to be able to come out of the difficulties that they are facing.
Exactly, like you say, it's that optimum level of functioning that we're really striving towards.
Yes. So just look to go ahead. Let us see how can we help regulate children in their sensory processing needs. So basically, sensory processing can you can give them sensory breaks. You can give them reading breaks. You can give them writing breaks. You can just give them play breaks. However, whatever is your child is in need. So these are the few examples of fidget toys that has been like this is just the therapy ball, just to be that they can go and bounce themselves, just they can be okay if they are sitting for a long period of time for any activity on a table, and they need a moment break, so they can choose whatever they want to choose. So there's just few examples of fidget toys and that can be used for sensory breaks. This is basically a few more examples what can be done. So like for with a therapy ball, you can ask them bounce, or you can ask them to just lift up the ball. You can ask them to lie on the floor and keep the ball over their legs and just give them a deep pressure. You can use trampoline so that they can do jumping activity. Then there is therapy, there is clay, there is slime for more of the sensory, if they are overly stimulated or they need something to play with. So you can give them these activities. You can give them music, you can give them lights, you can like let them be in the dark room and give them fairy lights or give them some bright lights so that they can just calm themselves down in the dark room. You can make use of plays like jumping jacks. You can give them animal walks like frog jump or just commando crawl. There are n number of things that can be done for a child to have a sensory break. You can just give them a tight hug if they want, just to give them that squish, or if they are seeking proprioception with their body awareness being less, so you can give them a just a tight hug may also work in such situations.
And Rabab, how do we know the right sensory break for each child? Is it the same
Yes.
for everybody?
No. So every child is different. No child is same as the other. Okay, so it basically depends on at that moment what your child exactly needs. And if you know your child very well, with the help of the therapist or the you do we basically do an assessment before any like we set goals. We know our children, so we know what our child needs. If my child is like always overly stimulated, I'll give them more of calming activities. Like calming activities can also be deep breathing, just some yoga poses, like make it like close your eyes, relax, meditate. Could be calming, one of the calming activity. Giving them deep pressure would be calming activity. Slow counting, or giving them soft music in room, that can be called as a sensory break, and it's more of calming activities if my child is overly stimulated. If my child is understimulated, is always lethargy, like always low or not paying attention, so we give them more of activities that would excite them or overstimulate them, like jumping, running, bouncing, and giving them music. In music also there are variations. For calming, you use soft music. For making them more hype, like more active, you give them like little music which this lights them up, or you give them lights which are sparkly bright lights in a music environment. So every activity differs from a child to child, and we need to really know what exactly our child needs.
And as a parent or a teacher, how would they identify if their child needs the alerting exercises? What might you see in a classroom that would show you that?
So see, these are some of the sensory breaks that have been already like we have put in. So see, here also is this calming activity, alerting activity, right? So out of these activities, you can have almost everything in the classroom because it doesn't need more of the equipment. Also, there are classroom which have to be equipped. Like you should have at least an area, a small corner with a dark tent maybe, wherein the child can go inside, relax with the lights. Or you can have outdoor play areas with soft play, different textures, with slides, swings. I'm so sorry. They can just go and relax themselves over there, or they can play in an outdoor setup. Different textures also help them with their sensory regulation and help them calm down a little bit after they have a much of an outdoor play.
Great.
Yes. Like in your school as well, do you have such things? Like, do you have things that can help to regulate the child?
Yeah, so we're really fortunate. What our classrooms within Safford British School are very well equipped. The school has various areas for OT and for sensory, and we also have the dark tent, like you mentioned, Rabab, where the children can have exposure to the vision therapy with the twinkling lights and the calming darkness. And as well, in the classrooms, we regularly use fiddle toys and wobble chairs and wobble cushions. And that's not just in the bridge classrooms. All across the school, you'll find children having their sensory needs met in various ways. And even, during these difficult times where movement around school is not so easy, the school actually allocated little spaces where the children could go outside and jump about and move about in like an allocated square that was socially distanced, because we have to consider these things when our children are contained to the classroom.
Oh, that's amazing. Also, I believe you have access to the pool, swimming.
Exactly, yes.
Yeah. Yes, so even water is a great medium if you have to regulate a child with children with sensory issues, especially because water is a great medium. It provides a different sensory environment, so it helps them calm down. It helps them regulate themselves, and it really helps when they have to attend to a task with a lot of attention, and before that you're giving them access to pool and access to water, and they are actually been there for 15-20 minutes or half an hour to an hour. They actually regulate themselves, and they're much better after that. So
Yeah.
it really helps.
I've seen a lot of success with the hydrotherapy, and it really does calm our students down. After they finish a session, they're more focused. We see that their behaviour and responses are often more appropriate.
Yeah, that's what it is. It's basically magic of water. It helps, and it is really beneficial. So, like, how can we as professionals help children to regulate self? So,
So I'll just talk through a little bit about what we do within a school environment when we notice that a child is having difficulty regulating their behaviour or their emotions, and this is separate somewhat from the sensory, but also can be included within that. So the first thing we have to do is teach children to identify the way that they're feeling. It's really important because all the strategies in the world aren't actually going to work unless the children are able to identify that they are feeling uneasy, they're feeling nervous, they're feeling excited. So this is always our first step. Now, of course, we have children with very different levels of functioning, and we have to do this in different ways. So we might use social stories, very simple social stories, or scenarios like you can see on the screen, where we provide them with a statement and ask them to help reason what would be the correct response. Or even just this: how big is my problem? When children or even us as adults are feeling very frustrated, we have to take a step back and just look at whether or not the problem is as big as our emotional reaction. But we do need to teach our children just how to do that. And if you just go to the next slide, I'll just talk through the
yeah.
next phase, which would be them being able to then identify and classify their own emotions. And there are lots of different wonderful ways to do this, but these are just some of my favorites that I'm sharing with you today. So as you can see, there's a how is your engine running? And that helps children to identify, are they running too fast? Are they moving too fast? Are they too excited? Are they too hyper? Are they moving too slow? Like you mentioned, Rabab, lethargy, slow movement, slow response, inattention, or are they just right? And as we teach our children to be able to identify these things, we can place these little meters on their desks or somewhere discreet, and we can ask them, we can draw their attention to it and ask them, how are you feeling now? And then once they can point that out, we can move to the next step, which is strategies. And you can see we have these zones which are color coded, and this is something very, very helpful for children to classify and identify how they're feeling. So we can see that within the zones of regulation, for example, if a child is feeling blue, they might be feeling very slow, very sad, very tired and bored. And then we would give them the instructions of what would be best to do next. And we have all of these from green, where they're feeling great and they're happy and they're calm and they're in the right place to learn. And then we move on to the yellow zone where they're a little bit wobbly, a little bit anxious, and then red, which we really hope our children don't get to, because that's when they're feeling extremely frustrated. And typically this is where we might have an outburst of very inappropriate behavior. So by identifying these emotions, it gives the children the tools to be able to take the next step, which is the strategies. If you just go to the next slide for me, Rabab, please. So the strategies that we provide for the children would be these coping strategies, which some of them will be sensory based, like those that you've described already, Rabab, and some will be things like a check-in, an emotional check-in, having time, counting backwards, role-playing a scenario through. And the best thing to do is not just to give a whole bank of strategies and not tell them how to use them, but rather say to them, okay, when you're feeling angry, what would you like? What would personally help you? So you'll be able to see on the bottom corner of the screen, we have these activities where we ask the students to choose their coping strategies. So is it that you want to do some star jumps or stomp your feet? What would work for you personally? And for every child, that might be slightly different as well. But these are things that we can accommodate in the home or in the classroom with a little bit of support. And in ABA as well, when we are teaching our children to be able to identify their emotions and act appropriately, we might use this 3-step method, which you can see in the top right-hand corner, where children can identify when they're very anxious, they need to say, I need a break. Or our non-verbal children, we would teach them to sign, I need a break. And it's a process of giving them the correct response, the correct tool, the verbal communication or non-verbal, to tell us what they want. And then we will see a decrease in behaviours. And in the bridge and the wider school, we see these working really effectively on a daily basis.
Yes, yes, that is true. Even in like the sessions of occupational therapy, when we are truly working on improving the attention span for tabletop activities, be it preferred, non-preferred, and if a child is showing behaviors like not complying to the task or something, we give them moment breaks so that we know that they need to regulate themselves. They need to have that for attention span to coming back and doing the task that is to be like just to be completed. So yes, I think we use the strategies a lot even when the OT sessions are going on.
Exactly.
So yeah.
Okay, so when we think about what schools can do, of course we can implement the strategies that we've discussed previously, but I wanted to talk a little bit about going further and potentially providing interventions. So for teachers who may be joining us today or be watching, there are various structured interventions which are wonderful and I myself have used. This is just a few examples of them. The zones of regulation curriculum, which we spoke about a little bit earlier, it teaches children systematically to identify their feelings, place them into zones, and learn the different tools to be able to then self-regulate. Emotional literacy as well, it's teaching children the ability to be able to identify and manage their emotions. And then we have these socially speaking, and there's also a time to talk one from the same publisher, which is about teaching social skills, which again feeds into the ability to self-regulate. Because when our children can't socially communicate correctly and effectively, we will see these behaviours arise. We'll see difficulties with friendships. We'll see children not following the instructions of the teacher or of the group. So these are just some interventions that can be bought or purchased by schools. And then in terms of whole class strategies, Rabab has mentioned a few of these things that you can do in the classroom, really, really easy, but very, very effective and backed by science. You've got things like your wobble chairs or your wobble cushions. You can just pop them under the table. All of the children don't need to be on them. It can just be for your children who need that extra bit of movement to regulate. Or those fiddle toys. Teachers can be a little bit reluctant to give children fiddle toys in the classroom, and I completely understand that, because as a teacher, there's nothing more frustrating than hearing bang, 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 bang while you're trying to teach a lesson. But we can actually teach the children how to use them effectively. We can teach them to use them quietly, and we can teach them to use them just for a short amount of time. They don't need them continuously. It's just enough to satisfy that sensory need, pop it back in their box or their tray, and then continue. It's often when children are trying to pay attention to the board, to the teacher giving it input, that they might just need to fiddle with their hands, and that will stop them moving about and touching their peers and not being able to focus. And then we have the whole class movement breaks. It doesn't just have to be one child. We can do whole class yoga, dance breaks, wiggle breaks, whatever it is. And I'm sure lots of teachers are already implementing that. Now, the interventions that I mentioned, particularly social regulation, it doesn't just have to be for the class. It could, for an individual, it can be done as a whole class as well. And also those calming corners, like you mentioned, Rabab. I just wanted to put this slide because I found this fantastic resource on Twinkle that gives lots of different activities for the different zones that children are in. So if teachers aren't sure or parents aren't sure, okay, we've identified they're in the blue zone, they're low and they're lethargic, but what next? This gives you lots of different guidance on the things you can do. For example, different outdoor activities, different board games and feelings, reflections. There's lots and lots of information you can find there on Twinkle as well.
Okay, I think one more strategy, the visual schedules, and they really help. If they just give you the activities that they're supposed to go through the day, and you incorporate equal amount of movement breaks in between, even that helps a lot for a child to self-regulate themselves in the classroom, especially because
Definitely.
they know that they're going to get this once they're finished with the activity that they're asked to do. So visual schedules also really help them out for self-regulating themselves.
Exactly. And you touched on something really important, which is the motivation. So children and adults, we all like to be motivated to complete tasks. And, you know, when we've got that visual schedule that shows us, okay, after I finish this task, I'm going to go and get to play, or it's going to be lunchtime, then that also helps to encourage us and reinforce us for the appropriate behaviours. So, Rabab, as an occupational therapist, how would you be able to help then if a family or a school have tried these strategies and they still feel as though their child is struggling to self-regulate?
Yeah. See, basically a child, especially a child who is diagnosed to have ADHD or is on spectrum, is they have the brain is not functioning at the optimum level as the neurotypical developing child would do. They somewhere are 30%, the brain is 30% less developed. That is what the studies say. For example, if your child is 10 years old, like a neurotypical child is 10 years old, your child who would be 10 years old but will be having a brain functioning as of 7 years old. So you need to not over expect things out of a child. Like you have to expect things as per their cognitive age and not as per their physical age that is. So that is more important. First, knowing your child is more important than, and keeping high expectations is something that is not really encouraged. It is more baby steps at a time. So sensory breaks also, if my child can sustain for a tabletop activity for maybe 5 minutes, I would give him a sensory break at the fourth minute. And so the child is also encouraged to do the next activity because they know they are going to get what they want, especially with self-regulating themselves. We can increase this time eventually and slowly as much as it's possible. So you have to really customize their plan and work accordingly. So as an occupational therapist, we give them a lot of sensory strategies, which we have already covered throughout the presentation. That includes movement breaks, that includes playing with different textures, slimy, gooey, shaving foam. You have n number of things, fidget toys, sand, you have grass, you have a lot of things that can be incorporated. We also use movement-based activities on swings, slides, working on their emotional regulation like that, which helps eventually increase the tabletop and the tolerance, the sitting tolerance towards a tabletop activity.
Yeah,
That
and
is,
like you say, Rabab, it's all about the individual child's
yes.
ability and their level of functioning. And don't be afraid or don't be worried to give your child more movement breaks than another child who's the same age. We really have to individualize our approach and tailor it to where they are. And also, I just wanted to mention that child psychology counselling can be really helpful for children who are struggling with regulating their emotions, particularly potentially older children or children who have faced a particularly challenging time. And also ABA can be another method that would really be able to help with children developing attention and focus and tabletop tolerance and a lot of the other things that we've mentioned. Myself and Rabab are firm believers in a multidisciplinary team. We like to work with OTs, speech, psychologies, ABA all together because we feel that the outcome is far greater improved when we have that team working together. And we've seen a lot of success working side by side already. And highly recommend to parents and schools to partake in professional guidance and help as well. I'm so aware that we've flung through with so much different information, and you probably have a lot of questions, and you might want to ask us things related to your own child as well. Rabab, do we have time to take some questions from parents?
I think so. I mean, we can just take it and we can try to answer as much as possible for the
Yeah.
next minutes.
Let's see. I think you can write into the
Yeah, I think they
chat
can write.
box.
They can write in the
Yeah.
chat box.
You've just got our information here. If you do have any questions that you'd rather ask individually, or if you'd like to know more about anything that we've discussed today, you can feel very free to pop us an email, and we would really be happy to help out or give guidance in any way that we can.
Just to add upon the last thing, I think family support also plays a major role in self-regulating a child's behavior, because if the parents or anyone else or grandparents, siblings, everyone are not on the same page, it really becomes difficult for a child to self-regulate themselves. So I believe that family support is more important in than everything else. You can take professional guidance, but a child is with the family for more hours of time. So I think the family support plays a major important role in a child's development.
Yes, I totally agree with that, Rabab. I can see some of our audience are thanking us for our talk. So I think that they've kept their questions to themselves, but do feel free to approach us at a time that's convenient to you. Thank you all so much for joining us today. And Rabab, it's always a pleasure to work with you and to listen to you
Same
as
here.
well.
Yes, same here, same here. Thank you so much, everybody, for being there with us.
Thank you. Take care. Bye.